After all the questions you have made to me about tooth whitening, finally today I'm about to give you the 3 most important points that I consider that you have to listen before you do tooth whitening. The third one is absolutely necessary, mandatory that you wait and listen for that one. That one can bring so many bad consequences that you can end up in a root canal. And I will tell you why. What is the step number 1? You have to be so sure that you have no decay. What I refer to decay is caries, it's a cavity. This is a huge cavity. If you look at this is a bacteria that went in there, and the bacteria went inside the canals, and it's gonna have a root canal, this patient. But if you have this type of cavity, you know what is gonna happen? It's gonna increase, and it's gonna be faster the way that the pain in your mouth is gonna come, because the chemical that we use for whitening is very strong. Now, if you have a healthy mouth, the enamel is gonna protect you, because the enamel is thick, and the dentin is the one that is gonna be whitening. So this chemical is gonna go through the white part of your tooth to whiten the dentin. The dentin is what gives us the color to the tooth. The enamel is transparent, translucent. Now, but if you have any cavity small open, then it can have it, the chemical will give you some sensitivity or pain. Now, once your dentist said, perfect, you're clear, you have no decay, your teeth are clean. You have to clean your teeth before. They don't have plaque, they don't have calculus. Once you have all that under control, then the second recommendation I'm gonna give you is stay with your dentist and ask him to do your tooth whitening with your personalized trays. They will make it and they will fit your mouth, like my friend here. So they will fit your mouth. They will not touch your gum, because if it touches your gum, the liquid, it can be very irritated, will burn your gums. And they give you 1 tray for the lower, 1 tray for the upper. And the dentist will teach you, you will see later when I show you the images about the bleaching tray. It's soft, and you're gonna put the liquid that they give you on the office, that it's about 15-20%, because you're gonna take it home, the concentrated of this chemical. And the lower, the same. They teach you for how long you're gonna place it in the mouth, when are you gonna take it out. And on top of it, they will give you a solution that if you start developing sensitivity in all these areas of your gums, like if you have this patient is getting tired. So if you start getting sensibility in these areas of your mouth, then they're gonna give you a tray with the liquid to calm down your sensitivity. And that is amazing. You cannot have this in another place other than your dentist. There's another whitening that is extremely famous. You get in an office, in and out. They're doing it in a cruise ship. They're doing it in a marketplace. Please don't do it. They're very aggressive. The liquid is more aggressive. And if you don't have a solution right there to take it with you, to be applying, you can have another bad consequence affecting your tissue. So that's my second recommendation. And the third recommendation is the most important, as I tell you. If you do not follow step 1 and 2, and you want it, let's say you say, you know what, I don't care, I'm going to the pharmacy. When you choose the product, be sure that product has a very low percentage. It has to be between 15 and 20. You have to be so careful the way you apply it, following the instructions, because I have a patient that came with all the tissues burned. The whole mouth was burned because of excessive whitening material that he placed in his teeth by accident. And I have to refer him to the periodontist to take care of his tissues. There's another patient that can happen that the sensitivity was so bad that the pain that they have was amazing. I have to do endodontic tests in each one of the teeth. And when I have to do endodontic testing in each one of your teeth of your full mouth, of course you're gonna pay more money for a consultation. And this program is about to save you money. Remember, it's about achieving free dental treatment. How? By no treatment at all. So if you follow the steps of preventive measure, you will not end up with this, how these patients ended up with me having all these problems of sensitivity, and some of them I couldn't stop them and ended up in a root canal. The problem is you have a root canal, that's great, that's when I am there, that's why I'm busy, and I save the tooth. I fix the nerve. In this one that it wasn't affected to begin with, now it's affected. I fix the nerve, and guess what can happen? Excessive whitening can also give root resorption. Do you remember I talked about root resorption? Can create resorption here, like this area. It's a space, and it's created by stress cells. These are molecules that I studied during my research on root resorption at USC, and they're gonna start destroying your own tooth. And a lot of people think that you cannot repair root resorption. I've been repairing root resorption since 98, 99. They can easily ask me, what do I do for that treatment? I will be happy to share that information to your dentist. However, avoid that. Avoid the money, the time, and the pain if you follow simply the steps. Also, if you don't want to have your teeth stained, don't drink red wine. If you drink red wine, brush your teeth after, because the color, it will not stay in your enamel. Excessive drinking of tea, also you have to brush your teeth after the tea. So it's a pain in the neck. So either you want the tea or you want to be brushing the teeth after to keep your teeth clean. White. And also that white doesn't even look natural. So keep a normal white for yourself. You don't need for a good smile to have all whitening your teeth. The other situation can happen if your mother had tetracycline when you were a baby. You have another stains and your dentist is going to tell you what to do to try to remove that are tough stains to do. And also if you have berries, you take a lot of berries, that's good. Just brush your teeth after. Coffee, black coffee will stain your teeth. Anything that is a dark liquid, Coca-Cola, any soda that has a dark color and when you're drinking it, it can happen. I'm not saying Coca-Cola because I love Coca-Cola, but just go and brush your teeth. Rinse with water. Remember we said in one of the shows, use water and rinse immediately, because water can rinse immediately and it will help to balance the pH. When we talk about caries, the pH that is acidic of the bacteria for caries or cavity, it will balance with the water pH that is higher. So, or have your toothbrush always available. So I hope this advice, these recommendations of mine are good for you. I'm not saying it's good to go to the pharmacy or it's bad. Just follow the instructions of your dentist. That is the best thing to do. If you have any more comments, any questions, another topic that you want me to talk about, let me know. I will be here happy giving you all the answers that you need. Thank you. Well, now finishing our episode on tooth whitening. And what do we have here? We have the trays that these are the study models they did for me earlier, Arlene. And then I have them made by Dr. B. Jack. And he finished, gave it to me. And when you receive them in your dental office, they will give you a small box that you can take home. And they give you this liquid, which has a very controlled amount of concentration of the chemical that we use for whitening. It's a company called Opalescence, but it's only sold for dentists. And later, you're gonna have your tray. So look at the tray. I told you it was a soft tray. It's easy to use. And then you're gonna start one by one. It's just like when I teach you about the brushing, follow a certain order. So in this situation, you finish, you put a line, and you go these movements because you want to go to these outside areas that you want to have whitening. And then you place your tray, that's it, voila. And we do the same with the lower. You take it out, you place it in your mouth, and then the next day, this is done at night, and I tell you why. I take it out because I'm gonna talk funny. If you do it during the day, the saliva is, we're talking and saliva is flowing, it's a lot of saliva flow in the mouth, and we're gonna finish the liquid very quick. But if you do it at night, the mouth is resting, the saliva is not fluent in the mouth, it's just low, and you're not moving your mouth, so the liquid can work more efficient in your whitening of your teeth. And another situation is that if you feel any sensitivity the next day, then you can always call the dentist and ask him what to do. He for sure will give you a package like this with a desensitizer. That's the advantage that you do it at the dental office. And you're gonna place the desensitizer the same way. and place it that night or maybe in the morning for a certain amount of time, depending how much sensitivity. Most likely, if it's too much sensitivity, you have to stop. But if it's not, you can do the next night. And maybe you don't do it the whole night. Maybe you put it a couple of hours at night, and if you wake up, you take it out. But whatever you decide to do, it's a lot more control if you do it at the dental office, because the chemical is controlled, it's very low. You don't have burning of your gums. You're not gonna have destroying your enamel because the liquid is very aggressive. So my advice to you is try to do it at the dental office as much as you can. And if you have any questions or any comments, just write in our channel. I hope you want to subscribe and follow us on Instagram. I will be happy to answer all your questions. Thank you very much.